Nature. Welcome to another edition of Ultimate Health, your ultimate guide to healthy living. You can hear my voice, then he's done it again. And there's a need to testify. I love this one. Take this. It's Sunday, 2:05. Indeed, we are live. Indeed. We must testify, right? Ultimate Health on Joy 99.7 FM. Oh, I'm in the studio with one of my great guys, Dr. Michael McCarthy, consultant obstetrician gynecologist, CEO of the Sinal Specialist Family Hospital, Tema Community 6. We last had him, I think, in April, where we discussed the medical wonder of multiple births, twins. He's taking us through the principles, the fundamentals of the menstrual cycle. Today, we are looking at uterine fibroids. What are they? What causes them? Can we prevent them? Signs, symptoms, and of course, treatment. Tell a friend to tune in to Joy 99.7 FM. WhatsApp is 055 11 11 997. And we're live on Facebook and YouTube. My favorite, Michael. Good afternoon.
Good afternoon, Nortey.
Yeah.
It's a pleasure to be here.
Oh, Charlie,
awesome.
I'm loving the shirt.
Thank you.
Huh?
It's my birthday shirt.
Is today your birthday?
No, not today.
You got it for your birthday?
Yes.
You're just trying to make sure that I don't find ways of getting it off you. But it's great to have you in the studio as always. A wonderful friend, resource to the program. Uterine fibroids. I think you have a book on that, don't you? No?
Yes.
Yeah.
We have a book on that. We have 2 ebooks on that for education of women and men to answer some of the most common questions. So we'll make that available to our listeners.
For the education of women and men.
Yes.
Men need to know.
Men need to know. It's good to know.
They don't have a uterus.
No, they don't have a uterus, but they need to know about what is going on with women.
Okay.
because men are linked to women in one way or the other.
Right.
Joy 99.7 FM.
Okay, so let's get to business. Uterine fibroids. The name suggests something to do with the uterus, which only women have, and then fibroids. What are they?
Right. Uterine fibroids are quite a common condition of the uterus.
Okay.
And as you said, uterus is for women, right?
Right.
So this is a disease.
We're smiling as men, but we're
women.
concerned. Yeah.
Yes.
Okay.
And it has to do when the cells, the normal cells of the uterus, start to change and start to behave in a way they are not programmed to behave.
Okay.
And so they start to grow into these masses of cells. They may be very small, a few millimeters across.
Okay.
To as big as a melon or something. In fact, the biggest one I've removed, which was very recently, was an 11 kilogram mass.
Wow.
From one uterus, yes. So that is how they look like. They can be very huge, but most of the time, one big mass.
Right.
But most of the time, they are much smaller. There are multiple in the uterus. They grow at different parts and points in the uterus.
Okay.
And then they cause their challenges.
Okay. Few key things you said there. Very common condition of the uterus.
Yes.
Right? I've seen 20 to 50% of women will get them. I've seen 40 to 80. When you say common, yet you call it a disease or a disorder of the uterus, it's a bit confusing. Is it normal? It looks like quite a lot of women will get these. So can you just clarify?
It's not normal.
It's not normal.
It's not normal.
First and foremost.
It's not normal. The normal uterus does not have fibroids.
Okay.
Okay. So if there are fibroids in the uterus, then that's a disease. That is a challenge.
Okay. Common doesn't make it normal.
Yes.
Okay.
Exactly.
Right. Okay. So these are growths of the uterus or growths in the uterus or near the uterus.
In the uterus, of the uterus. They originate actually from the cells in the uterus. The uterus is mainly muscle.
Okay.
It's a special type of muscle which has these little cells which are all intertwined together.
Right.
So they can stretch out like
flex.
in pregnancy.
Yep.
And then they can also contract really strongly.
Okay.
And so if it's pregnancy, they'll push out the baby. If it's menstruation, they'll push out the blood and so on.
Okay.
So it's a muscle cell, set of muscle cells intertwined and they work together.
Okay.
Occasionally, genetically, some of these muscle cells will now change and turn into cells that have become fibroid cells.
Okay.
They don't immediately become what we see as fibroids.
Okay.
They will then slowly multiply over years usually and become masses of cells. And so now they become like a mass or a round thing,
right.
Which now occupies the space where those cells were. So if it's the very inside, it will occupy there. If it's within the wall of the muscle, it will be there. If it's more towards the outside. But generally, almost all fibroids are in one way or the other attached to the uterus.
Okay, great stuff. 14 minutes past the hour of 2, which is also 14, on Joy 99.7 FM, with me, Nortey by nature. I'm in the studio with Dr. Michael McCarthy, my favorite Michael, my favorite gynecologist. No bias to the others, but we do quite a lot of stuff with him because he's available, accessible. That's why we do it with him. And we know you appreciate the education he provides us. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. And shortly, I will activate the phone line so you can get in touch directly and ask your questions of Dr. McCarthy. So we've got these growths, right? Common, not normal. So next logical question is, well, what makes them happen? What causes these growths in women?
Right. The main underlying cause is a genetic cause.
Okay.
Where that woman is genetically predisposed to the cells in the uterus changing into fibroids.
Okay.
So basically, we can say
that translates to a family history.
A family history.
Right.
So it may be in the family. It may not be an overt family history, but generally there would be a family.
So there's a genetic
component to it.
to it.
And then there are other things. There are the risk factors, and then there are the the things that one would do or engage in that will affect whether the fibroids will grow or they wouldn't grow.
Okay.
So the risk factors, the commonest obviously is age.
Age.
As age increases, then your risk of uterine fibroids will also increase up to the time of menopause. So the highest percentage will be from women 30 years and above.
Okay.
Even though we find that they do occur in those in their 20s as well, it's not as common. And it's not strange to find a woman with fibroids first presenting when she's in her early or mid 30s.
Right.
So that is it.
Age.
Also, age.
Right.
Obesity, having a high body mass index,
Okay.
also puts women at risk. Remember, as we talk about these risk factors, it has to do with first your genetic predisposition,
Okay.
and then your risk factors are building up on that.
Okay.
So it's not just one thing, and then I'm obese, and so because of that I'm risk of
Right.
fibroids. Not so.
Okay.
And then we have women who have never given birth to a child.
Right.
Also tend to have some kind of increased risk.
Okay.
Interestingly, some studies showed that having a child between 25 and 29 has some protective effect
Right.
on having fibroids.
Okay. So pregnancy can be or is protective when we are considering.
Could be within,
Right.
but we need to consider the entire thing.
Okay.
We have a lot of pregnant women who have fibroids,
Yes.
right? Women who have been pregnant before have fibroids. So it's not
But women who have not had children before are at a higher
Yes.
risk or vulnerability.
Yes, vulnerability.
Okay.
A higher risk for that.
Understood.
And then also we have those who are of our race, the African race.
Okay.
Okay, so like we're comparing to other races, we realize that it is more an African race type of disease.
Oh dear.
And that can be quite significant for us.
Okay.
And then we also have people who had their menses before age 10.
Right.
This is not a very strong one, but it's one
Early
of the
onset
factors.
of their
Very early
menses.
onset. It's about 8, 9. Could have some increased risk for that.
Okay. Right.
So these are things about the person. But then, of course, what you do and the things that go around with you can also have some effect. Yes.
Okay, great stuff. 18 minutes past the hour of 2. We're learning about uterine fibroids, the causes, symptoms, treatment with Dr. Michael McCarthy. Any questions, concerns, experiences, share them with us on WhatsApp 055 11 11 997. We're live on Facebook and YouTube. This is Joy 99.7 FM. The program is Ultimate Health. Okay, so you brought in early menses, your menarche, your first period, right? So we can use that also as a possible risk factor or an indicator.
Yes, a risk factor.
Alongside other considerations.
Yes, exactly.
Okay. When you start to menstruate, when you're beginning or at the onset of your reproductive period, right? Or reproductive life, there's a lot of hormones and stuff involved. Do fibroids, or is there any relationship between hormones and fibroids?
Yes, the fibroids prefer or they occur in the environment where the normal female hormones are very active.
Right.
And so this is from puberty until menopause.
Okay.
And that is the big window where you would see fibroids developing.
Okay.
And so you'd not see fibroids in a girl who is not in her puberty.
Okay.
And in fact, in less than 20 years old, it's not very likely that one will see. Though you could start seeing some growing fibroids at that age, but that's not very common. And then usually new fibroids will not be growing after the age 50.
Okay.
So that hormonal environment is really the important part.
Okay. Can I say cautiously, right? I don't have your qualifications, that they feed off the hormones, or the hormones facilitate their emergence and growth?
Yes, so the hormones help the normal uterine muscle cells to grow.
Okay.
You see, and so these cells, though they are abnormal, they are still uterine muscle cells.
Okay.
Okay, so they still have that advantage of being sensitive to the reproductive hormones, the estrogen and progesterone.
Right. Okay. Great stuff. This one says, wow, Senior Nortey, this topic is very crucial coming from a man. God bless you, Samson.
Yep.
Kwame, I think in Keta, well, I've got Samson Kwame. I see Keta up there, but it doesn't.
The men are important.
The men are important, and that's why menopause starts with men. Aha. Good morning, bro. Happy to hear your voice again and glad listening to your selection. Okay, this is, I think, something earlier. Okay, referring to Iggy. Let me go back up. Hello, doc. During my menses, I have several thick, huge clots. Which I'm told is nothing to worry about. The fibroid size, I'm told, is about a bean size. I'm almost 44 years, and the cramps are also very intense. Is there anything that can minimize the cramps as well as the clots? Mousy sends that from Pokwasi. So Mousy seems to have been told she has fibroids, which are bean size. She's 44, and she's talking more about the related clots and the pain of her menses. Let me just read a couple more. We don't want to deviate from the core topic, but it's all very relevant. Good afternoon, Nortey, and hi to Doc. Welcome to my home. Oye, in Athenia. Oye, Charlie, we greet you. We throw you salute. Huh? Right. This one says, hello, my sister had this 5-year family planning method. The rod inserted into her arm. For the first 3 months, she saw her menses, although not as usual. However, since then, she hasn't had her menses at all. She has been on this plan for barely 3 years. What could be the reason for her menses not coming? Stephen from Imprieso, Kwewu South.
Men are representing today.
Yes. But they are threatening to,
deviate us
to menstruation.
Their interest area.
Okay. Doc and I have a fine way of controlling the journey. Huh? Okay, so those are the ones directly related to Ultimate Health. So this one, no, not the one from Oye. The other one from the 44-year-old. Just a comment on that so that we get back on track. So...
Yes. So she said that her menses were changing. I mean, this is a nice gynecology consult question. Actually, that's how they present. Mm-hmm. And sometimes it's not just one thing, and sometimes it's not what is obvious. Mm-hmm. And so it'll be great to really go into what is going on. It could be fibroids, yes. It could be an endometrial polyp. It could be something on the cervix. Mm-hmm. It could be cervical cancer. Not to scare her, but these are things one needs to check on this.
Okay.
Because if your periods are becoming more painful, you need to check on what is going on. If the bleeding is becoming more heavy, it means something new may be happening. If this is what has been happening all along, then there's probably no cause for alarm. But I get the sense from the question that this is something new that is developing. Yeah. And this woman definitely needs to see her doctor to be able to decide what is really going on.
Okay, so her focus or her primary interest was how to minimize the cramps as well as the clots. That's from Mousy. She needs to see...
Yes. Yeah, we need to know what is causing the cramps, what is causing the clots.
Okay.
And then one can put on the appropriate treatment. She mentioned that there was a fibroid.
Yeah.
Now, if this fibroid, even though small, is in the very middle part of the uterus, where the menstrual blood comes from, it could be responsible for pain. Okay. It could be responsible for excessive bleeding. Okay. And therefore may need to be removed. But if this fibroid is located maybe within the muscle layer on the outer surface, it probably is not the cause of this increased pain and bleeding.
Right. And the clots.
And so this brings us to the point where it's important
Diagnosis.
to really individualize what is going on with the patient and the fibroids she has, because the fibroids are not all the same. They don't come in the same size, location, and combination. Right. And it's always great to actually find out what is really going on before making a decision on treatment.
Great stuff. Ultimate Health on Joy 99.7 FM with Dr. Michael McCarthy. And I know, and Michael knows better than me, that as soon as the questions on the menstrual cycle and problems start coming, we've got to stem the flow. We're talking about fibroids. We'll take them in related connection, but remember our focus so that we can do the job properly, okay? So there was one about a 5-year plan and the rod in the arm and all that. Any quick comments on that?
No, that's probably a normal effect of that contraceptive method. Okay. It's probably working really well, and that's why she's getting this symptom. Okay. So it should not be a problem. Okay. If she's worried that she may be pregnant, despite the device, she could just check. But it's not likely that she is, and this is just a side effect.
All right. The flow has started, Doc. Hi, I'm Abigail. I've been diagnosed with fibroid. Okay. I bleed heavily and was advised to take my uterus out or have a hysterectomy. Yeah. I don't have pains, but I feel weak. Okay. Yeah. Hold on, Doc. Just let me try and clear the bleeding on WhatsApp. Good afternoon, Mr. Nortey. Please, I'm almost 36 years old in November. I have no children and I don't have any symptoms of fibroids. My menses last for only 3 days. Should I have any worries at all that I'm planning to have my own children? Regina from Sakumuno Estate. Quick one to that.
Well noted here. What stands out for me in this question is fertility and 36.
Okay, right.
That's where I think the challenge is. Yeah, age
and childbirth.
And so if she has been trying to get pregnant at this age, then she definitely needs to see her doctor and have a detailed discussion.
Okay.
Checking on her ovaries, checking on her eggs, deciding on what should be done for her at this point. Yes.
Okie dokie. Okay, the one who was advised or told about...
She said she had a lot of symptoms and needed to have her uterus removed.
She has been told that she should have it. Yeah.
And she feels weak. So these are some of the symptoms that are happening. So heavy bleeding leads to anemia or low blood level.
Okay.
And that can make one feel weak, not just because the blood level is low, but one loses a lot of iron. And iron helps your brain to function, helps your enzymes to function. And so she may be having low iron levels as well.
Okay.
And so weakness comes in, fast heartbeat, and so on and so forth. And obviously, it seems like the cause of her problem seems to be from the fibroids causing excessive bleeding.
Right.
And that is probably the reason for the advice that, well, you're 44. I don't know whether she has children or not.
Okay.
But she said she was 44, and if she has completed her family, that may be the best way to treat it. Yes.
All right. Okay. We'll get to treatment and management. We haven't even gotten to symptoms properly yet. And you guys are in business. Hello, Nortey by nature. Thank you for bringing back my Lexus bill, doctor. Do you know why? Because he sounds so much like Lexus. Now, ask doctor.
I'm honored.
Yeah. Doctor, is a polyp a thing to worry about? My wife was diagnosed of polyps. Sometimes she gets heavy bleeding and cramps, and sometimes she does not even feel any pain during her menses. This is from Frank from the camp.
Yes, I mean, you should worry about the polyp because you give you a lot of symptoms, just as he's describing, and also it's treatable.
Okay.
So,
what is a polyp?
We don't know exactly what type of polyp he's talking about, but this is a little growth, a smaller size growth inside the uterine cavity, which could be from the endometrium. Sometimes the fibroids could also be a polyp.
Endometrium being the layer, the inner layer,
lining of the uterus. Yes, where the menstrual blood comes from usually.
Right.
And that part can become a polyp or a little mass or growth, which then causes more bleeding. And during menses, it's not pushed out. It stays in and creates more problems and causes the uterus to bleed more. Sometimes fibroids, if they are located in the same place, can also become polyps and give problems. The good thing is that these are treatable conditions, and so this can be addressed without major surgery.
Okay, so medically, clinically, the polyp is distinguished from the fibroid. Oh?
Yes, a fibroid could be a polyp.
Okay,
could be in that position where it is then called a polyp because of how it looks, how it acts. And it's not inside the mass, it's just hanging on the outside.
Okay, I have a lot of growth on my WhatsApp. But I'm going to stop the growth and get back to Doc. Doc, so you need a proper examination and a diagnosis to say you have fibroids. You don't just listen to other people and conclude, right, that you have the same symptoms and so on, and therefore you have fibroids. How do we pin this down? And can a woman, is there anything that would give telltale signs that you may have fibroids? So I'm tiptoeing into symptoms, but how do we conclusively diagnose that a woman has fibroids?
Yes, you are right. I mean, one would suspect because of the symptoms.
Okay.
They've said all the symptoms already. Having increasing pain.
All right.
Especially during menses, sometimes even outside menses.
Okay.
Having increased bleeding.
Okay.
Sometimes spotting in between is not time for bleeding. Sometimes increased discharge.
Okay.
Can be some of the problems. Sometimes you feel a mass.
Right.
You feel that there's something moving around in your belly, or you feel there's something growing in your belly. It's getting bigger. I'm not talking about increasing fat in the belly, but some mass growing in there.
When you say just a problem sometimes that comes up, right? Belly. Musum.
It's a very non-medical term we are using, but we want to see how we can
get it. Is it your lower abdomen? When women say they feel something, where should they be describing or say or locating this feeling? This thing you said can be sensed and felt by the woman. Is it, where is it? Or is it
right? Different people describe different parts of their abdomen. So in medical terms, the abdomen.
Okay.
In different ways. So it's good to listen to what people say.
Okay.
And then to carry out an examination and say, right, so where do you feel this? And they'll point to the place.
Okay.
And that'll give you a clear indication,
Right.
because sometimes what you think is in the lower part, the person is pointing to the side.
the word being an indication?
Yes.
Which needs to be followed up on.
Which needs to be followed
Right.
up.
Okay.
You see, yes. So back to symptoms. The other symptoms could be pressure on the urinary bladder.
Okay.
And so what happens is that people tend to then feel like they are not emptying their urine properly.
Okay.
Or they are having a feeling that they haven't finished emptying the urine.
Okay.
Or they are urinating more frequently.
Okay.
And with not too much volume.
Because this growth is pushing on the bladder.
It's pushing on the bladder.
Okay.
Yeah.
Remember, your uterus is between your bladder and your rectum. Am I right?
Yes.
Okie dokie.
It's deep inside the pelvis. When
Right.
you touch the front part of the bottom of your abdomen, you feel the bone there, and beneath that is
Okay.
where the pelvis is, and that's where the
Right.
uterus actually.
Okay, we're
located.
still on pinpointing this diagnosis.
Yes.
Is it, or does it have to be done by a gynecologist?
Yes. So the diagnosis, no, it doesn't have to be done by a gynecologist.
Okay.
Doctors can diagnose uterine.
Okay.
All other doctors could diagnose uterine fibroids.
Okay.
So taking a good history, find out what is going on with the person.
Okay.
Doing a physical examination to see how big is this uterus, what's happening in the abdomen, and so on. Is she looking very pale? Has she lost a lot of blood?
Okay.
And so on. And then doing some tests like an ultrasound scan
Okay.
is the maybe the best,
All right.
simplest way to find out, okay, so what's really going on in this uterus.
Okay.
That can be seen. Sometimes you need other things like an MRI scan or a hysteroscopy
Right.
and laparoscopy and other
Right.
things.
So
but
that's
those are not
imaging.
the mainstays. Those
Right.
are not the mainstays.
Okay.
The mainstays really your physical examination and an ultrasound scan.
Okie dokie.
Yes.
Right. Doc, in the absence of these symptoms, would a gynae or any other doctor regularly want to examine a woman's pelvic area, the uterus, and all that?
Joy.
Let us remember.
97 FM.
We haven't said it, but let us remember that the minority of fibroids will give symptoms.
Okay.
So we only have about 10% of people who have uterine fibroids
Right.
who are coming with the symptoms of
Okay.
uterine fibroids. So it's a disease that you are having, but you're not having any symptoms. You're not feeling any ill effects, so to say. And so, as part of a gynecological check, once a year or every 2 years, one would want to check the uterus, physical examination of the uterus, and we could do an ultrasound scan also to see what is really going on in there, because there may not be any overt signs
Okay.
that these fibroids are there. And sometimes you meet women whose fibroids are quite large, but they have not detected that there is anything going wrong.
Whoa. Right. 34 minutes past the hour of 2. We're trying to do due diligence to the topic
Yep.
of uterine fibroids. The road is quite bumpy. And so we're not speeding at all. My guest in the studio, Dr. Michael McCarthy of the Sinal Specialist Family Hospital, Tema Community 6.
99.7 FM.
Hello, greetings, Ultimate Health Team. Please, if a lady of 29 years menstruates for a day, here we go, instead of 7 days or less, please, is it a risk factor? You see the way they tied the question to fibroid. Is it a risk factor for fibroid? Pasolo in Sunyani. Let me quickly read a couple more.
Today we salute the men. I think the
The
men,
men are
yeah,
in
they
business.
are.
All right.
Yep.
This one says, hi, good afternoon. Doctor, I have fibroids 1.6 and other smaller ones. I'm guessing this is looking at the dimension or the size. As
Or
I-
is this 16?
it says 1.6 here.
Okay.
All right. As at 8 years ago, I have stopped menstruation about 6 years ago. I usually have anemia, or something I was going to ask you about, anemia.
Yes.
Right. And I'm always on blood tonic. I had gallstones, and those were removed by the doctor. But the doctor said the fibroids will shrink as I grow. I had gallstones. Okay, I've read that. But the dizziness and blood tonic is a worry, right? So looks like anemia is in there somewhere or some weakness. Can I come for an assessment for possible removal?
Not this is a good question. You see,
Right.
this points.
Just a sec, Doc.
Oh, sorry.
I am for possible removal. I am 51 years. Ama from Amasaman.
Right.
Yes, go ahead, Doc.
Yes. I mean, this is a good question. It throws light to the fact that even though you may have fibroids diagnosed, they may not be the cause of your symptoms your problem.
Okay.
She's having anemia. Granted, she could be having this anemia from bleeding during fibroids, but she said she's not been bleeding for the past 6 years. And so it's unlikely that her anemia is from excessive bleeding due to fibroids.
Right.
Her low blood level may actually be from something completely different.
Right.
And so obviously she needs to have a clear assessment to see what's really happening with her.
Right. Okay. Related, I saw earlier, Dede in Maryland. Dede, thanks. I understand the fibroid shrinks during menopause is related to what Doc mentioned earlier, the presence and activity of the hormones. But can it dissolve totally and go away by absorption by the body? Why doesn't it vanish? Dede in Maryland. Let me just quickly do... Some are typing as I'm clicking, right? Ooh, this one just says hello. Okay, hi. The boss Nortey, it's like Dr. Mike is coming from Lexis Bill's family.
Wow, I'm
Please,
so blessed.
with regards to uterine fibroid, is surgery the best option or medication? Especially organic medication or medicine. This is Samson again from Keta, I think, asking for a friend. We are tiptoeing towards treatment, but he's asking, throwing that in under the bus. This one says, why is it not? This person is typing plenty politics. Let me go. Oh, okay. So, shrinking after menopause, right? And will it disappear or vanish? And then somebody's bringing herbal or medicine versus surgery. Or
I think we'll come to the treatment
we'll come to those
in
later,
a bit. But yes, the menopause issue I think is very important because we had a previous one that talked about menopause and then a 6-year one. And then, so yes, after menopause, the fibers tend to start getting smaller because you don't have so much estrogen, you don't have so much progesterone in the system again. There's no cyclical change. And so the fibers tend to start to shrink, get smaller. Somebody was asking why they don't just vanish. I don't know what medical term is vanish, but disappear completely. Maybe that's what it means. But yeah, they will get smaller. It depends on where they started from. If you started with a 15 centimeter mass and it's getting smaller, it probably will not disappear. But maybe if you started with a 5 millimeter mass, maybe it will not be perceptible after a few years. Whether you call that the vanish, maybe so. But the important thing is not whether they are still there or not. It's whether they are actually giving symptoms or not. You see. So yes, they start to shrink after menopause.
Doc, I didn't hear you mention things like pain during intercourse and a few other things. Would they be related to such things? Be related to fibroids?
Can be. We have some fibroids that are located in a position where they can give pain during intercourse. Some can give hemorrhoids because they place pressure on the rectum. Some can press on the kidneys or the tubes draining the kidneys. Either one of these. And if they are very large, they can press on other parts. We've had one that was even preventing the woman from breathing properly. Because it was so large. And so these are some of the less common problems that could be happening.
39 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living with me, Nortey by Nature. I'm in the studio with Dr. Michael McCarthy, consultant obstetrician gynecologist and CEO of the Sinon Specialist Hospital in Tema Community 6. We're taking a close look. We are dissecting uterine fibroids, causes, symptoms, and treatment. We haven't gotten too far, but we're still doing relevant business. WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. And I'm going to activate the phone lines cautiously. 030-221-6541. 030-221-6541. We'll take some of the questions. But, Doc, it brings me to a question. So, if they're not causing problems based on their location, size, and other related factors, it sounds like if it's not broken, don't fix it.
Exactly.
Is that the rule of thumb?
No, not the rule of thumb that way, but if they're not giving symptoms and they're not big enough, we will probably just leave them alone.
Okay.
So just the fact that there are fibroids present is not enough justification to remove them.
Okay.
Remember, removal means surgery, some
Right.
kind of surgery, and so that will become So you need to have very good basis for what you are treating.
Okay.
And if they are not giving any problems and there are no other issues, most of the time we just leave them alone.
Okay. If you're not worried about them in that sense, but there's some bleeding or related symptom, would you then be treating only the symptom and leaving the fibroid alone?
Exactly. So when it comes to treatment, we have to decide on what we want to achieve.
Okay.
If it's pain, well, let's treat just the pain. If it's bleeding, let's just treat the bleeding. If it's anemia, let's treat anemia.
Okay.
So it depends on what is going on, and then we can draw that treatment plan, and then we can put it together.
Okay. I know the men are listening. Are they part of this plan?
The men are very much a part because now let's take, for instance, a younger person comes, she's 28, she has smaller to moderate fibroids. She's planning her family in 2 to 3 years' time, and she comes with her husband.
Okay.
What do we do?
Right.
You want to prevent these fibroids from growing their max. And so you want to put some intervention measures.
Okay.
It could be exercise, it could be diet, it could be weight loss, it could be, the kind of things that they take in, medications and so on. And the husband is part of it.
All right.
I mean, if you put a wife on a diet plan, or let's make it easier. Let's say you put the wife on an exercise plan, and she has to do this exercise plan alone. Very quickly, she'll get tired of doing this exercise, following this exercise plan.
Okay.
But if you put the couple on the exercise plan, it's more likely that they will encourage each other, to work together and to get this thing done.
They better already have a foundation of a good relationship.
Well, they had better. Maybe that would solidify their relationship.
This prescription is going to cause trouble.
Maybe to rather build the relationship. But maybe they'll start to go on walks together.
Okay.
One of the ways to prevent. So one of the things in my book is about how to prevent uterine fibroids. It's a very odd topic, but preventing at different stages.
Looking after
it's
yourself.
Exercise.
Right.
Because exercise has been shown. They did a study, I think it was from Italy, where those who did 7 hours of exercise a week or more had slower growing fibroids as compared to those who did 2 or less hours of exercise a week.
Okay.
All right. So if we put you on 7 hours exercise a week, that's quite a lot.
Okay.
That is 2 hours a day for 3 days plus an hour a day for 1 more day.
So that could translate to preventive protection.
That could do prevention.
Right.
And if you are doing this together with your husband and you are talking about, important issues that concern you as a couple in marriage, that may strengthen the marriage, right?
All right. Great stuff. 43 minutes past the hour of 2. I know some of you will ask probably, can I transfer the fibroid to the man? But don't go there yet. Don't go there. Okay. So there are different decisions and considerations when it comes to treatment. Once it has been confirmed you have fibroids. I'm just seeing this one. It says, what are the next steps when... Oh, why is it not going down? Yep. Okay. What are the next steps when you are told the fibroids have calcified or are calcified?
Celebration.
Oh, why?
That celebration, that's nice. There's something we didn't speak about, and I think I'm glad this has come up.
Okay.
So one of the things is that sometimes the fibroids undergo some changes.
Okay.
From their normal original state. They may undergo degeneration.
All right.
Okay, where they change from one state to another. The commonest is with pain, and it usually happens during pregnancy, but can occur outside pregnancy too.
Okay.
Pain, and then they can become calcified like this. They can start to shrink because
calcified meaning they've hardened.
They have some calcium and they become hardened. Usually the calcium is on the outer surface,
right,
and they become quite hardened. And those ones usually don't grow much further.
Okay.
Because they've been kind of killed off, and so the body kind of starts to reabsorb them and starts to shield them off because they are no more alive. Let me say. Some of them become quite liquefied, and so they look more like cysts, and so then they become less problematic because they are no more active
Okay.
and they are no more creating a mass within the uterus.
Okay.
So what he's describing is a degenerated fibroid
Okay.
that the body is trying to eliminate. And so you start to see the calcifications.
Right.
And that's good because that fibroid is not likely to be growing again.
Okay.
Of course, new ones could come, but that particular one may not be growing. So
Okay, great.
celebration time.
Great stuff. Let me ask this big one, which always comes up. The relationship between fertility and fibroids.
This is also an important topic, and we've spoken a lot about fertility and so on. And because fibroids are common, and because fertility is also common, and because the age group of these two issues is the same,
Right.
you will have a situation where people who have fibroids may also be experiencing fertility challenges.
Okay.
And those experiences.
So when you said because fertility is, you meant infertility is also common.
Yes.
Okay. Right.
Yes.
Good.
Yes. So you are having these two things happening in the same age group, in the same type of people, and so it creates a little bit of difficulty to say, oh, if you have fibroids, it causes infertility, because at the same time we have a lot of patients with fibroids and who are getting pregnant easily.
All right.
Carry their pregnancies to the end. We have patients with huge multiple fibroids and they are pregnant.
Okie dokie.
So just having fibroids alone
Right.
is not equal to infertility.
Okay.
Maybe that's the message.
Okay.
Maybe that's the biggest message we
Right.
must give. Like
Okay.
having fibroids is not the same
Right.
as being fibroid equals infertility.
Okie
No.
dokie. Right.
But fibroids do contribute to your fertility because they may be located in positions where they are not allowing the endometrium to develop properly.
Okay.
They may be causing some blockages in certain places. They may cause recurrent miscarriage. So even if you are getting pregnant, they could cause miscarriages.
Okay.
They'll give complications and problems during pregnancy. Maybe that's a bit out of the
That's-
question.
that's another
but,
stage, yeah.
But if it is early on in the pregnancy, it can create some problems there too. And so you will not be able to achieve the live birth that one was planning.
Right.
And so, yes, fibroids are significant in
Right.
causing fertility challenges.
Right.
Sometimes you would even meet a couple and you'd advise that these fibroids need to be removed before you embark on pregnancy
Okay.
because of the location and the way they...
Okay.
they
Right.
behave. Yes.
Okay. Location, type of fibroid, and all the other considerations, right? Phone line still active, 030-221-6541. Ultimate Health on Joy 99.7 FM. WhatsApp is 055-1111-997. My guest in the studio, Dr. Michael McCarthy. Having said that and asked the question about fertility and gotten a clear, unambiguous answer from you, right, with due explanation, what about cancer? My readings suggest that these are typically, if not always, non-cancerous benign growths. But many people link them with cancer. Fibroids and cancer, Doc.
So fibroids are not cancer.
Okay.
And they're very unlikely to develop into cancer
Amen.
either.
Okay.
So we are not relating the two things.
Okay.
However, if the woman is past her menopause, past 50, usually 48, 50,
Okay.
and she starts having, and I put it in quotes, new fibroids starting to grow in the womb,
Okay.
it is very likely that these are not fibroids, but that these are tumors which could be cancerous or malignant.
Okay.
So we could have malignant tumors of the uterus,
Okay.
which appear to look like fibroids,
Right.
and they can occur in those who are a little older,
Okay.
from 48 onwards, and so we need to understand that difference.
Okay.
So if the person also has fibroids already, gets to menopause, and then these fibroids start to continue to grow,
They're getting new ones or the old ones are
that
growing.
is a sign that we may not be dealing with fibroids. And
Okay.
that brings us back to initial statements that we need to have a clear diagnosis and a clear treatment plan, a
Right.
clear understanding of what we are dealing with, so that we don't just do the wrong thing
Okay.
for what we think is fibroids, when in actual fact it may be something else we are dealing with.
Okay, great stuff, great stuff, great stuff. During my yearly visit to the gynecologist for physical exams, this is the day in Maryland again, before the pap smear, the gynae with gloves on does insert a finger or two and then press on certain areas of the abdomen and ask questions if you feel pain, etc. I understand the growth can be felt, right? She's also added, is fibroid cancerous? We've answered that.
I think we just answered
so
that.
she's talking about some kind of digital examination.
So we can do an examination of the person
Right.
to find out the size of the uterus. Do we feel fibroids? Fibroids feel firm, you know, like the tip of your nose. That is how they feel.
Okay.
You know, they are not soft.
Right.
They may look soft when you just look at them, but they're actually quite firm.
Quite firm.
Yes, and then and that's how they cause some of their problems. And so when you're examining a patient, you could actually feel them.
Okay. Right. Okay. I don't want any questions on the examination, but yes, the qualified person is examining the uterus and looking out for key salient things. Do you need to undergo surgery to remove a fibroid, even if it's in a smaller stage or earlier stage and smaller?
Yes, it depends. It depends on what the fibroid is doing and what the symptoms are, and if there is need. Sometimes you have small fibroids that need to be removed because of the problems they are causing.
Okay.
And sometimes you have bigger fibroids which may not be needed.
Okie dokie. Let me ask this one as well. Fibroids and pregnancy. You said that, the presence of an active fibroid does not mean you can't get pregnant. And so if you do get pregnant, it means that the pregnancy is growing alongside the fibroid in the same space.
Yes,
right?
yes. Fibroids can cause a lot of problems during pregnancy.
Okay.
They could cause severe pain. They could cause the uterus to start to contract. They could cause preterm contractions. They could cause miscarriages. And this could be a challenge. They could also make it difficult for the baby to position itself properly for delivery.
All right.
In
Competing
fact,
for space.
And also compete for space, yes.
Right.
Also compete for space, and especially if the mass is large, that can be a big problem.
Okay.
The fibroids may also twist the uterus or turn the uterus in a way it's not supposed to be.
Okay.
If it's a smaller uterus, normal size, not pregnant, that may not be a big problem.
Okay.
But if it then happens during pregnancy, that will reduce the blood flow to the uterus, and that could become very severe.
So it's a serious consideration during pregnancy. It is a serious
consideration and can lead to a lot of problems.
Okay.
Granted, there are many times when the fibroids are smaller and not significant, and they just become insignificant during the pregnancy.
Okay.
So that's fine. But many times they are located in places that can cause problems. Even after delivery,
right?
They could cause excessive bleeding after delivery. They could
wow.
cause problems with the placenta, especially if the placenta is now implanted where the fibroids are. That could also be a lot of problems.
Wow.
The placenta could separate. There could be poorer blood flow to the placenta and so on.
That is why it's also important to let your gynae know if you're planning to get pregnant, or if indeed
Yes.
during the management of this that you become pregnant.
Exactly. So part of the plan in dealing with fibroids, you want to understand the type of pregnancy plan that the patient has, when it's going to happen, what is planned for, has the person finished having her family size and so on. Very important considerations.
Folks, notice that when Doc mentions pregnancy, he attaches plan.
Plan, yes, plan is important.
Plan, not accidentally on purpose, as some people will say, oh, I'm pregnant. So you should plan this, and it should be related with your overall plans, life goals, and health status.
Yes, not ideally we want to plan, but you see, something like pregnancy sometimes comes unplanned.
Okay.
Sometimes even when you are planning not to get pregnant, you get pregnant, despite all the intervention measures.
Right.
So it's challenging. It's
right.
challenging,
okay.
really. And there are many situations, but if you have the opportunity to plan, it's best to plan, because that will help you to get the best outcome possible for you. Yeah.
Right. I've heard it being related to preterm births and other things, breech presentation and other things. Again, still with fibroids and pregnancy. Are these correct things I'm reading?
Yes. So one of the biggest problems is the degeneration.
Okay.
And this degeneration, and that comes with a lot of pain and sometimes even fever, temperature, and so on. But what it then does is that it irritates the uterus and may actually start causing uterine contractions.
Oh, wow.
And if this baby is not at the end of pregnancy when it is supposed to come out, this could lead to a preterm delivery or premature baby.
Wow.
That can be a challenge, yes. And also, of course, because it's competing for space, depending on how it's located, the baby may not turn properly in the uterus.
Okay.
And that's when you get your breech presentations or transverse and so on and so forth.
Okay.
And becomes a problem.
Great stuff. So we're hearing and learning a lot about fibroids, their symptoms, their impacts, and so on and so on. I hear things like severe back pain and so many other things. Right. So in managing a woman with these things, you're considering all the things. Sometimes you're just managing symptoms because you don't consider the fibroids to be the primary cause of their presentation or their problems.
Exactly.
Okie dokie. I'm wondering, we have a few minutes left, but anything in the, should I say, earlier, descriptions of what we're dealing with when it comes to uterine fibroids that we've left out before we start considering what is available by way of treatment and indeed management? Anything we've left out?
Well, one of the biggest things that I think that is best described as we have in the book is what can you do to prevent fibroids from becoming problematic, to help to reduce the rate of growth or to prevent them from picking up at the beginning. And so you probably have to find a way for us to get this ebook. It's an ebook. It's an ebook. It's a free ebook. Yeah. So how you can share that to your listeners. I'm sure we'll find a way to do that. Our producer will find a way to send our book to them.
All right. So it's good to equip yourself with information, right?
Very, very nice, important information. Yeah.
Right. Then you can actually have a good, meaningful and fruitful interaction with your provider, right? Your gynecologist or whoever you're speaking to, right? You share your experiences, you add something you've learned or queries or questions you have, and that makes it a very good partnership. But Doc, I keep hearing you refer to possible ways of preventing. I am a bit lost because prior to this, and I've done this a couple of times with you, I have read that they will occur and that there's not much you can do to prevent fibroids. Can we just tie that up so that we get to understand? I know you're authority in this, but why would somebody write or put out information which suggests that, well, by and large, they will come, but we need to look at what they're doing, where they are, and so on?
Yes, it's a good question. I mean, there are things you cannot prevent. You cannot prevent the kind of genetic makeup that you came with. You cannot prevent that your mom or your aunt or your sister has fibroids, and that's the genetic part. So we cannot prevent.
Right. Okay.
You may not even be able to prevent them from starting to grow in the first place.
Okay.
But you remember I described to you, you have a normal cell, and then you have a cell that undergoes a certain transformation that now makes it a fibrous myocyte or a cell from the uterus of the myometrium.
Okay.
This cell now has the propensity to start to grow up normally.
All right.
But the risk factors we talked about and then your lifestyle factors come into play.
Which are modifiable.
Right. And that is where we are talking about the prevention. Let's say it's more of a secondary prevention.
Okay.
It's not a primary prevention that says, hey, I'll never have it.
Okay.
Like an immunization. No.
Right, no.
But this is more of, well, yeah, I'm having it, but I'm not going to allow this thing to give me problems. I'm going to prevent it in that way.
Okay.
It's a secondary prevention. And that's very important because we choose what we eat.
Right.
We choose the kind of things we eat, the quantity we eat, and so on. So our diet is important, our exercise, the type of things like tea we take, whether we're eating meat or fish, and things like that. Body weight is a bit more difficult, but if you can modify it, that is also a good way to address it, and so on. So there are things we can do. Even alcohol, especially beer, could actually be a risk factor for increasing the rate of fibro growth.
Whoa.
So you could balance things like that.
So those are choices you make, lifestyle choices, which you can modify. And therefore, it's essentially have an impact on what we're discussing.
Yes, and therefore prevent this problem.
Okie dokie. We're out of time, but let me read this one. Why is it saying March and May? Oh, okay. So this is somebody who's WhatsApp us earlier in the year, but today says, this is Jennifer. It says, good afternoon, Doc. I am 41 years. I've never conceived. I've been diagnosed with multiple fibroids with indistinct endometrium and hydronephrosis of the right kidney. I have not conceived before and I've been trying for 3 years. Will surgery help resolve both issues of pregnancy and the hydronephrosis? Right? This is from Safoa.
So you can see that this is a fibroid that is causing more problems than the usual one.
Right.
This is affecting the kidney.
The kidney, yeah.
You see, and that can be significant, especially if it affects both kidneys.
Okay.
Then you have a bigger problem.
Right.
But this is pressing on the kidney, enlarging the tubes that are draining the kidney,
Okay.
and probably damaging the kidney in the process.
Right.
And so this kind of blockage needs to be relieved immediately.
Okay.
Otherwise, that kidney may be damaged. So
Right.
just on the basis of that, surgery is indicated for this woman.
Okay.
Then she brings in the issue of pregnancy. So one would want to know, okay, so what are the other reasons why she's not getting pregnant? Try to do that whole evaluation, and then using the removal of the fibroids as a part of the treatment for her fertility issues. And I think that is probably the way to go. But we need to look at her age also. Her age is 41.
41.
So we need to understand what is her ovarian reserve, or the eggs in her system, what's going on there. And will those eggs work properly? What's the chances of success, and so on? So these discussions can be had.
Okay.
Yes.
So clearly for this woman, and I'm trying to wrap up on her since we're out of time, surgery is indicated because it is related to the renal or kidney complications.
Exactly.
Okay.
Exactly.
Right? And she was asking if surgery would correct or address both to give her the gift of conception. Those are later determinations that can be made, but definitely you're quite clear that surgery is indicated in this scenario.
Yeah, in this scenario, definitely is, yes.
Okie dokie. Right, so many are saying they are also interested in the book. Is it available on the Sinal website? Nope. Or yes?
It's not on our website, but we will. It's actually available on our Instagram.
Okay.
It's on Sinel Hospital Instagram. Yes.
Okie dokie.
Our name is Sinel Hospital on
Okay.
Instagram. So
all right.
You could just go in there.
Abeku does all those
Yeah.
magical tricks, so we'll make sure we can give you a link or something.
Yes, we'll give you the link for the download in this video. So watch this space.
Watch this space. Doc is so radio savvy. That's why they're linking him to Lexus. There's some family history in there. We need to go and do some.
I'm coming to Lexus for some lectures and some coaching so
Yeah.
that I can get to his level.
Right, Doc. Always a pleasure and always so educative. We have not touched on treatment and
I think we
management.
need to do
All right,
treatment, yes.
and we had to take our time because those flowing with the menstrual issues ambushed us for good reason, though, because they've got
Yes.
Dr. Michael McCarthy in the studio. Many thanks, Doc. We'll
You're
see if
welcome.
we can do a part 2 and see what can be done to manage and treat fibroids.
Yes.
Many questions out there. Some say, well, I've had it removed, it recurred, and so on and so forth. We'll deal with those in a subsequent program. Right. Many thanks, Dr. Michael McCarthy.
You're welcome.
Of the Sinal Specialist Family Hospital. Our sports team now is coming up with, wow, big game between Arsenal and Man United. I know Man City thumped some people. Was it yesterday? This one is at the Emirates Stadium and will bring you live commentary and analysis starting at 3:30. Nowhere else but Joy 99.7 FM. Many thanks for joining us and contributing to Ultimate Health. This Sunday we'll be back, God willing, with another educative, transformative edition.